Welcome to Community Chats, bringing you stories and insights from the heart of Community Living Toronto, a non-profit organization that proudly supports people with intellectual disabilities and their families. We will focus on stories of belonging and inclusion and topics of interest from communities across Ontario and the world. From uplifting moments to breaking barriers, from innovative policies to ideas from leading thinkers, we continue to advocate for inclusive communities and support the rights and choices of people with an intellectual disability.
Hi everyone, this is Brad Saunders. I'm the CEO at Community Living Toronto, and welcome to our Community Chats podcast. Really glad that you've chosen to join us today. Today we're joined by Marg Spoelstra, who's the CEO of Autism Ontario. Marg has been a tireless advocate for individuals with autism and their families, working to create a more inclusive and supportive society. In recent years, the prevalence of autism has been on the rise. According to the latest data from the Centre for Disease Control, approximately 1 in 31 children in the United States are diagnosed with autism spectrum disorder. This marks a significant increase from previous years, highlighting the urgent need for awareness, support, and resources for those affected by autism. Marg will discuss the challenges and opportunities of Autism Ontario's increasing prevalence and their efforts to address them. Health and Human Services Secretary Robert F. Kennedy recently commented on his plans to find an autism cure, suggesting environmental toxins contributing to the rising diagnoses. His remarks have, to say the least, sparked mixed reactions from the autism community, advocating for support over a cure. Join us as we explore these important issues and hear from Marg about the work being done to support individuals with autism and their families. Stay tuned for an enlightening and impactful conversation. Hi, everyone. Pleased to join me today, Marg Spoelstra, who's the CEO at Autism Ontario. Marg has got a ton of information and experience in the human services field, and has been a really strong leader at Autism Ontario, guiding the organization through many changes and evolutions. Really looking forward to this conversation today. Marg, thanks for joining us.
Oh, thanks so much, Brad. It's a delight to be with you.
Great. Maybe we can start out. You've been in the human services and caring sector for most of your career. Tell us about your journey.
Wow. It's been my life has always been directed in ways that I haven't necessarily chosen, but has chosen me. And this career for me was not my intentional plan, but really started out in many ways. One, because my mom has always been a woman very committed to social justice. And she instilled that in us as siblings and our family for many, many years. So long before I got to any idea about a career, that has been part of my family experience. And then I played on a girls' softball team. And our coach at the end of the season, I grew up in the States.
Yeah.
Our coach at the end of the season said, gather around, girls, we have to have a conversation. We need some of you to work at a summer camp and using the R word, which was common in those days. So this is for children with disabilities, with developmental disabilities. And that was very common in those days, but those were women, they said, it's important for you to give back to your community. We need people to work at a camp. So I was 14 and I worked in the kitchen. I worked with her son who had a developmental difference, and also with several other young people. And that was the beginning of my career. What I didn't know at the time. So
I have a similar experience, so that's excellent.
I was hooked.
Yeah.
Oh, that's great. And I met all kinds of folks on the autism spectrum who I didn't know had autism or were autistic. And but it was a fascinating experience. And my first interaction with a young woman was about an exchange in communication that, and I won't go on about it at length, but it was a wonderful experience where she would imitate the Bugs Bunny cartoon.
Okay.
And she kept waiting for me to take my turn in the dialogue. I had no clue. And she would just keep saying those words and waiting for me to respond with what you say. And so she would say, "Nee, what's up, Doc?" And I'd be like, "What? What is this?" And she just would repeat it repeatedly. And she would say, then she would go, "What's up, Doc? Say it." And I was like, "Okay." So I said, "What's up, Doc?" And she said, "We're hunting rabbits." And that experience was the beginning of understanding that communication is a two-way street and that people come to that from different angles. And it's our job as those who have more fluency with our communication or understanding to figure out how to be partners in communication. And that sometimes it means you need to change what you do to get it right. And that was an early lesson for a 14-year-old
Yeah, for sure, for sure.
that actually ultimately ended up having me work in that camp. And I absolutely loved it, with children through adults, for the whole summer. And it became the reason I ended up working in special
Oh,
education, which is
fantastic.
what my
So,
background is in.
and whereabouts in the States was this?
This is in a place called Holiday House Camp on the border of Pennsylvania and New Jersey, in the
Okay.
woods in a giant house that
Okay.
looked like The Shining, something from The Shining.
My first experience too was at camp, and it was a camp for deaf kids and adults, but also we had 2 weeks of special camp, and they brought people that lived at Huron Regional Center who were also deaf. Similar kind of experience where you're,
Yes,
off working at a tuck shop or and trying to get people to decide what kind of beverage they want and giving choices and just seeing what that life was like living, in this case, people living in an institution without a lot of freedom or choice or voice. And it does have an impact on you as a teenager, growing as you're growing up and deciding what to do.
absolutely. And that became also part of my experience in institutional settings, because that was the story of the day, which dates us, Brad. But,
Yeah, I know.
but it also speaks to the fact that it's actually not that long ago. Um, so, in the grand scheme of things, we are still living with the effects of institutional days, in the way that we conceptualize difference and disability, and how do we respond as society members, and what we do to make a more inclusive world. But
Yeah.
having lived through that was a very eye-opening experience, and shifting over the many years from a medical model, from a isolationist model, to how do we become more inclusive as a society,
Yeah.
is a path we've been on, and that we're not there yet.
Yeah. So your career took you into special education, and
Mhm.
then you I don't how long have you been with Autism Ontario?
I've been here for 22 years. But before that, I was at Geneva Center for Autism
Hmm.
for many, many years. Before that, I was a teacher in Ontario and in New Jersey. I also worked in Alberta in the transition phase from deinstitutionalization to community living,
Okay.
with all the folks who had lived the craziest lives in a institutional setting where resembles humanity, to
It,
moving folks out into the community, into their own
yeah.
homes,
I
and
laugh, but
really
it's so true. Now, when would that have been the deinstitutionalization in Alberta? What year were you involved with
back in the
that?
80s.
Okay.
Yeah, early 80s. So it was earlier even than that. But I worked at a place in Calgary, and also it's interesting. I have seen some folks. It's a very small field. At the end of the
Yeah.
day, what goes around comes around, and we move and cross paths frequently. But folks who were part of that, the time of Wolfensberger's thinking,
Right.
and what do we think about folks, and their right to self-determination.
Right.
And so that was amazing. But there were folks who hadn't lived in typical
Yeah.
human settings outside of an institution. So we had to teach, what does it mean to be an adult living in a community, regardless of what your story is? What does it mean to not be told everything you do, organized in a medical model format, when you get up, when you go to the bathroom, when you eat, what you get to participate in, who controls the choices you make about your clothing, everything.
Yeah.
And then trying to help folks move successfully into more independent or supported independent living.
Yeah.
And that was fascinating times. And watching how we understood disability, how we talked about it, how we worked together as staff, together with folks. It
Well,
was the most transformative time of my life.
yeah, it sounds like you were I was involved, less so, but involved in moving some individuals out of institutions into community. And again, at that time, it was moving into group homes. But I remember we
Yes.
transitioned one fella who was in Prince Edward Heights near Belleville in the county. And we were told he had a toolbox that he carried around everywhere. And we were told by staff in no uncertain terms, don't ever let this guy lose track of his toolbox because he will get very uptight around not having that toolbox, right? So we had all these protocols built around toolbox. He moved with us into a home and never cared about that toolbox again. Like just never came up again. And a
Right.
while later we thought, maybe these protocols we've got are just ridiculous. The point was he lived in a place where it was the only place he could keep his stuff safe, was
Right.
locked in that toolbox. And now that he was in a place on his own, he didn't need the toolbox because he had his own room and he knew people weren't going to take his stuff, right? And all that. So
Choices.
the profound changes were remarkable.
Yep.
That's good. So 22 years at Autism Ontario. I didn't realize you'd been there that long. Tell us about Autism Ontario. What do you do there? Or not just you, but as an
Yeah.
organization. Yeah.
As an organization, we've been around 51 years now, like a lot of organizations in Ontario at that time that emerged and started, around 50 some odd years ago and began thinking about disability and thinking about it when I was at university. Those were the days in the US at the time that there were lots of public laws changing, the rights of people with disabilities to an education, and all of that time was very much the case, the same story here in Canada. And so they were happening in tandem, and the rights of folks to an education, to safe and secure environments, were all being talked about, and organizations were starting. Autism Ontario was started by parents who were volunteers, who
So
were
often the case,
caregivers.
eh? Or yeah,
So often the case.
yeah.
And they were the ones who said, you know what? No one understands this thing called autism. There's no research happening. There's nothing understood about it. People don't understand what we as caregivers need to support our children who we love deeply, who are not being included and who are not understood, not being included, not understanding the nature of experiencing the world from a different lens.
Yeah.
And at that time, it was very much 51 years ago, thinking about what do we do about this? And the word cure was indeed something that people had on their minds, because at that time, all our approaches to disabilities, as you and I were talking a bit earlier, were about medical models. How do you
Hmm.
fix? How do you change? How do you make typical? And even the word normal, which was much more typically used in that time, which was there's been many paradigm shifts since that time, as we gain a deeper understanding of what it means to be human. And so for
Yeah.
Autism Ontario, that started out with parents saying, we need to change what's happening for us and for our children and for their future. Especially the greatest fear for families is what will happen when they're gone. And that
So
often
true.
drives
So
families
true.
to
Yeah.
do that. Yeah. So
Yeah.
at Autism Ontario, we had formed a number of chapters throughout the province of Ontario, and really became a very large organization of volunteer caregivers and some professionals who walked alongside them. And we're saying that we're going to help with this, and we're going to make changes in our understanding, gather more research, invest in understanding what is this, and how can we help people learn and grow in safe ways and be included as rightful citizens.
Hmm. Well, autism, there's always a lot to keep up with and to learn and understand. And I want to cover a few different areas, but maybe you can start with sort of what's the current state or understanding around what autism is and what causes autism?
Yeah,
And
so
maybe, and just to give it, so with the term epidemic has been thrown around a lot, right? And I know we're going to talk a little bit about RFK's comments last week around, but there is this sort of sense that there is an epidemic, that the incidence rates is going up from whatever it was, 1 in 88 down to 1 in 36, and it's not just in Canada and the States, it's around the world. We do some work with an organization in India that's seeing similar instance rates. So what's sort of what's your understanding of where things are at right now?
well, there's been a real evolution in the understanding of autism. And so each time the DSM decides to change the rules about what it means to have autism or to be autistic, and even the way that we talk about it as a society continues to evolve alongside, and sometimes in pushing out from what the understood medical terminology is. And then there's also a whole line of thinking about autism being a social construct. And so what does that mean? And how do we understand that? And so I think that will continue to change because ultimately it is a social construct. But that doesn't mean that the conditions that are associated with autism, and we know that thinking about autism as its own unique thing is not as helpful to us as thinking about neurodevelopmental differences. And I would say that that has been an area of real growth for us in thinking about the intersection of intellectual differences, mental health, obsessive compulsive
Right.
behaviors, and looking at epilepsy. All of these things can co-occur more frequently amongst one another. And when we think about those differences and thinking about the neurology of why is that, and asking questions in a different way that help us to say, and what makes the most difference for folks on the autism spectrum or for that whole cluster of individuals whose neurology is a bit different.
Right.
Doesn't make them less human, but it makes it a different experience. And that it means that we have to think about society as a wide spectrum of human difference, and
So
that
talk about that a bit.
somewhere on there.
Yeah, because autism, again, when we had started earlier in careers, it was talked about as autism, and then the sort of moved to more pervasive developmental disorder as being
Yes.
encompassing as autism, and now it's talked about as an autism spectrum disorder.
Mm-hmm.
Talk about that, or where, what, and well, just talk about that.
Yeah.
What do you, how's that evolved?
So
Where
the
are things now?
terminology nowadays, we try, unless we're talking about a specific health condition where someone has come to a medical practitioner to say, I need help. So doctors need to code that in some way. And so they refer to the DSM. So until the DSM changes, the Diagnostic and Statistical Manual.
And we're at the fifth, are we at the fifth version now?
Yes, fifth
Okay.
R. And so, yeah, so it just means that technically as a medical condition that can be funded, so often these things are tied to funding. They're tied, that terminology, to a medical practitioner's practice of giving a diagnosis.
Right.
So you still hear all different types of terms. So you hear autistic, you hear ASD, you hear autism. And so as an organization, we respond to all of that. And at the end of the day, what's most important is what people think about themselves. And so an ASD term may get you into a service, technically, but how you think about yourself is an entirely different story. So, and that's where we've seen lots of changes in the field where especially folks being self-advocates are saying, I'm autistic, it's part of my identity, and that's who I am. 40 years ago, people said, no, they're not autistic. It's they have autism. They have this thing. And now the pushback in that has emerged out of that self-advocacy and strength and identity movement that we see now. So we just say, you get to define yourself the way that makes sense to you when you're speaking about yourself. So we say, how do you like to define yourself? Or when you introduce yourself, what are the things that you want people to know about you?
Excellent.
And when and under what conditions? So those things have changed a lot. But at the same time, we also know We've learned some things about the nature of autism. We know that there's a very high genetic contribution to why someone expresses autism. And some of the work that's been done on that has shown us, has also helped to explain this overlap in many other conditions. So what we're seeing as we learn is that each person's autism is really like their thumbprint. They come to the table with a host of stories about themselves, their things that they may experience, their intellectual capacity, their anxiety levels. All of these things may come from genetic sources that we do see. And so why researchers are paying attention to that. So then the question is really, what does that mean for that person? Is that at what point is something disabling or a barrier to inclusion? And I think that is really the most important piece. And also recognizing that as we change in society and how we are seeing the numbers grow exponentially, as we know, well, I remember the days when we talked about, 1 in 1,000. And now we're looking at 1 in 50 in Canada, and in the US, even higher numbers. I think the most recent was, 1 in 32. And that's, even as I say these words, this is going to change again. We've been watching this evolution. But what does that mean for society? And actually, it probably means that we need to pay attention to these differences that are part of human expression.
Yeah. Is there a sense around sort of that incidence rate around 1 in 32 versus 1 in 50 versus what it used to be? Is there a sense how much of that can be attributed to a change in the diagnostic criteria through the DSM or a better understanding of what ASD is? And how much of it is more people are being diagnosed with autism genuinely? Like, how much do you have a sense of
Sure.
what that is?
When I talk to people who are experts in looking at research and organizing research that talks about this, what we hear is, one, that we got better at diagnosing. We got better at understanding the nature and breadth of autism and all of its expression. And maybe we don't even know all of it yet.
Right.
But what we have seen is catch up into folks who were either clustered into other categories for intellectual disability, for other mental health conditions, and were assumed to be something else. So we knew for a while, even within the education systems, both in the US and in Canada, that if you looked at labels as students came into school, someone may clearly have been autistic, but had been labeled as something else for years. Right. So then you start to straighten out based on new diagnostic criteria. You say, oh, we're going to meet with the psychiatrist, meet with our doctor or a healthcare practitioner, and they say, oh no, this kid's on the spectrum. Okay, so now you have a lot of people straightening out what was never understood fully, and you see this burst in autism diagnoses. But nowadays we're seeing even more, and I don't know. We don't know. We still, our sense is still that the rates are still have not caught up, and part of that is we still see adults. Every week we have contact with someone who is just understanding that they might be autistic
as an adult.
As an adult.
Wow.
So we know we haven't caught up yet. This is one of our daily experiences at Autism Ontario in our conversation with people. So I think that is that's still something for us to tease out and understand. But yeah, but we do know that we can see some of the genetic connections between parents and caregivers or grandparents, and that's why those studies that look at those multi-generational genetics can tell us a little bit, but it doesn't tell us why that happened.
It's not,
Right. The why piece is not there. So it's not a disease, right? We're not talking about a disease model here. We're talking about a difference.
Yeah, and that's a good sort of introduction to. I want to talk about sort of the work that the Ontario Autism Program, what's available for parents and what you've seen work for parents and those living with autism. But there is sort of an attention, and again, last week, I guess the Secretary of Health and Human Services, RFK Jr., came out and said that this is an epidemic and it's not and I think his quote was, genetics cannot cause an epidemic like this. and that they were going to put all their resources to either finding out the reasons for or a cure, the reasons of and the cure for autism by September, which seems, everything else aside, that seems like an incredibly ambitious timeline for anything. But what you saw that comment? What did that what comes to mind for you as you hear that, the framing there? I should also say that the way he described certain people with autism was just very demeaning. The idea of not paying taxes or writing a poem and all that, to emphasize that. And he will say that he was taken out of context and all that, but it was just it was very careless words at best.
Yes.
Anyway, what was your reaction to that pronouncement and that approach that's being taken?
Yeah, it's both concerning and it also is an interesting response. And as we know, historically, the Kennedy family has experience with disability. And they know that,
Yeah.
and they come from a line of family members who have experienced wide ranges of differences in their family. And so seeing him now in this role, I'm actually surprised that is not more informed about where we're at. And
So
what I hope will come
his,
out of it will be better information.
yeah, his aunt, I believe it was his aunt, that actually started the Special Olympics
That's right.
movement that's grown into a worldwide organization.
Yes. So there's a history of good,
Yeah,
as we've learned and grown. So I'm hoping that as as he understands and begins to talk with researchers, that he will gain a better understanding of where things are at. If autism research isn't where your focus has been, you may simply not be informed. And I'm going to be hopeful that as he speaks with those who've been at this for a very long time, and as we ask different questions, that he'll come to know that this is a very complex matter, and that the research is evolving, and that we have moved from a direction of the words of cure from probably his parents' generation,
right.
and his own as a child, to understanding and then thinking, where can we actually make a difference in people's lives, and how we understand that one individual's expression. So I'm hopeful that if that investment means a conversation with people in the know in research who are asking good questions and finding answers that are very elusive, we're not going to be talking about cure at all. We're going to be talking most about differences in the nature of autism, in how people learn. And what I hope can happen, and often what some of the conversations we're having in here in Ontario and in Canada is thinking about what can we know about, say, this individual and their challenges, let's say, with verbal language. We'll
Right.
just use that as an example. Are there folks whose expression of autism, either genetically or otherwise, tell us that they will benefit from a particular approach to helping them to achieve their best levels of expressive language and receptive language?
Right.
So how can we do that? And what can we find out from genetics that will tell us, don't waste your time on this other approach? And that's going to cause more anxiety for this individual rather than wanting to engage and using everything that they have, that they come to the table with as a human being, to be their best selves. And that's where to me, the real emphasis should be, is how do we understand folks who seem to have similar characteristics, and that we can help them just like we do with any human being. We know kids who gravitate towards sports or gravitate towards book learning, or who gravitate from doing things with their hands. So we start to adapt our teaching techniques and learning techniques to make that person say, I'm all in on this learning plan. And that's what we really want to see.
So,
And any other health conditions that are co-occurring with autism that we can earlier either relieve, like anxiety, which we know is a very significant challenge in autism, that is often part of the barrier to participating. And it has nothing to do with being autistic. It has to do with being anxious.
Right. Anxious about social situations, anxious about change, anxious about a number of things.
That's right. And we've learned that often autism itself is not the challenge. What the challenge is the environment and the conditions within society that we have prescribed of what it means to be typical,
Mhm.
that are themselves the barriers to participation, and that when we change the environment in a way that's conducive to that individual's learning and reduction of anxiety, that we see levels of participation and engagement and comfort not otherwise able to be expressed.
Yeah. That's a good perspective. I mean, one of the things I'm hopeful of when somebody of that at that stature and that level in a government says we're going to focus on an issue and try and get there quickly. I mean, there's an expectation that something comes of that. So, by the fall, there'll be something come of that. And I hope the worry is always that they come out with some representation that is inaccurate and
Exactly.
creates there's this myth around the impact of vaccines, right? Or
Yes.
and that has led to other issues. You hope something equally as harmful doesn't come from this, that it, to your point, asks some questions, points in some directions, makes some suggestions. But so that's the optimistic view, and I'm sure maybe we'll get together when something else comes out and chat about it more. I'd love to hear your perspective. So,
Yes, I'm looking
um,
forward to being at INSAR this week, next week, and hearing what's the impact of
yeah.
some of the
So the
decisions that have been made about cutting funding at the federal level in the US
right.
on research that
And what
has
is this that you're next week you're attending? What is it?
the International Meeting for Autism Research.
Hmm.
Occurs every year, has been for over 20 years now, where researchers from around the world who are looking at autism, but also looking at
Right.
all the different things that impact autism, and thinking about cultural expressions and situations where we're looking at what's available, the understanding of the nature of autism, uh, looking at how we educate, how we support caregivers, all of those things from a research lens from 35 countries.
Yeah.
Yeah,
Wait,
come
so
together.
is there anywhere people can go to learn more about that, or a Google term people could type in to learn more about that
Yes, they
conference or
should
that,
look at
that
Google
research?
INSAR, INSAR. So they will see if they Google INSAR and Seattle
Okay.
2025, they can find out
Okay.
more about that.
Okay. Good luck traveling to the States next week. That's
Yeah,
it's an interesting time for Canadians. Or I guess you're a former, did you change your citizenship? Or you
I'm both. I'm
you're
both.
both?
I'm a
Okay.
very
Okay.
proud Canadian, and also was born in the US, so I'm a US citizen as well.
Okay. Interesting time to be in your situation for sure.
Yeah.
Um, we've only got a couple minutes left here, and there's a lot of information Ontario has put out around the Ontario Autism Program and what supports are able to, and people can contact Autism Ontario for details on that. And there also is an intake organization. Where would people go if they want to learn more about what is available in Ontario?
Yeah, so they can always come to autismontario.com, and we will point them in the right direction.
Great.
That's one of our key um, tasks at Autism Ontario, is to make sure people have good information that's reliable, that they have connections within their community that are meaningful, and that they can feel confident about that information. So
Great.
if they come to us, we will definitely point them. And with regards to the Ontario Autism Program, you mentioned the independent intake organization, which is called Access OAP, which is a system for helping people get into that system and gain access to a needs determination and access to funds for four key areas
Okay.
in terms of communication, behavior, looking at occupational therapy, speech language pathology, and mental health supports.
Right.
So that funding is available for families in the province. The
Right.
challenge, of course, as we all know, is that there are a lot of people waiting for those services.
Hmm.
And at a time when and especially for the young kids who we really want to get involved in
Yeah.
good programs that are happening in this province, we know what to do and how to support in those early years, both families and kids in their learning, to support them with the best possible tools. And that we want everybody to have access to that
Right.
when they need it. And that we would hope that the waiting list for that would ultimately disappear. But it's not just about the OAP. So the OAP is through the Ministry of Community and Children's Services, Social
Right.
Services. So we know that, but we also know that what we're looking for is seamlessness in terms of those supports. And that means that our education system, our Ministry of
Right.
Education, needs to really step up on reducing barriers and supporting individuals, not only who are autistic, but students who may not learn in what's considered a typical way. And that is a human right. And we really want to see that area so that there's less demand on an OAP or a different kind of demand so that we get everybody to the place where they need to be. And then ultimately, how do you transition out of when you turn 18, 21? We talk often about our folks
Yeah.
slipping off the cliff again. And there should be a connection that moves people into the supports that they require as adults to live full lives and meaningful places in communities where they're cared for and loved and can thrive.
Yeah.
And right now, it's very choppy and the funding is inconsistent. Eligibility becomes an issue at times, especially in adult years. And the waiting is just not acceptable.
Yeah. It's the idea of a seamless transition forever. We've been talking about
Yes.
those times of change and transition, often related to age and often related to schooling. And I hope that before my career is over, that we get to the point where we don't talk about transitions because there's no need to. They just happen,
Exactly.
right? It's an expectation that people should have about what the future holds. One of the things that we worry about at community living is just hopelessness that can seep in to, parents raising their children as they get older and as they get to be aging themselves and are having difficulty providing care. What happens next? Who will step in? And what does a good life and what does belonging look like? So I really hope we continue that focus on getting that transition piece
That's so
right, and
true,
adding
Brad.
some hope
Yeah.
and predictability into a person's future.
Yes, that's right.
I feel like we just got started, but we're just coming to an end. So I'd love to have you back, perhaps maybe in the fall, to talk about what you're going to learn next week around the research, but
Mm.
also just to check in on where things are at more broadly, because I'd love to get into some of the details of the OAP program and also so much else that's out there. One final thought I'm going to ask you about. We usually ask people what belonging means to them, but I'm going to switch this up a little bit. We had a podcast recently with Sharon Grant, someone we both know who's really involved in so many things. One of the things she talked about was the importance of community and friends.
Mhm.
And having places where she could go, where she felt like she wasn't a burden, to paraphrase, and that her son belonged as well. What advice do you have for people who know somebody who's got a son or daughter or is on the autism spectrum, and what advice do you have for them around how to deal with making people feel like they belong, and how do you contribute yourself?
Yes. Wow, that's a a huge
Big
question. And first of
question.
all, I'm so glad that you talked to Sharon Grant and her and Clovis are
Yeah,
amazing advocates who we were honored to give our Jerry Bloomfield Award at Autism
yeah,
Ontario a few years ago because of their real focus on not only thinking about differences, but also what does it mean to be included in a community from every lens, from a cultural lens, from a Black lens, from a lens of participants as professionals in the community.
yeah, yeah,
And how do you support in the best way possible for the very thing that you said? What will happen when they're gone? And how do we know that our society is a place that's safe and welcoming?
yeah,
And so that belonging piece is such a critical piece. And when I think about families, the ones who have found those places are one is that they talk to other parents and caregivers who experience what they do.
mhm.
So connections to organizations like Community Living, Autism Ontario are critical places to be because you're
Sharon
going to,
talked about her faith community, church, being
and her
also
faith
another
community.
place. Yeah, yeah,
Absolutely. So communities that you already have in your lives and faith communities, I think, are vitally important and we have seen many changes happen within um, the Hebrew the Jewish faith, within Muslim, within Christian communities in church.
Yeah.
When those places step up, that's a place where you have very close ties in community, and it's a good place to really educate people, and to say, this is what my child needs to participate in our faith community in life. This is what my adult son would welcome. And so I would say if that's a strong connection for you, is to go there and encourage that. And those are parts, look at the places where you spend and where you anticipate that your child or your adult son or daughter may welcome participation as well.
Right.
And so I think also is to establish those relationships that are not with people who are paid to be there.
Right.
And Elizabeth Bloomfield, who is a lifetime advocate in this field, said that many, many years ago at a conference. She said, what you need are people in the lives of our loved ones, of autistic folks, who are there because they're your friend, because they care about who you are as a person and what happens in your life, regardless of who your parents or caregivers are, but because they
People
care
who
about you.
want to be there.
Yes.
Yeah.
So, and that's not easy to do.
No.
But if you can start that early on in their lives, is to find those relationships, make them genuine, and to establish that so they and you have a sense of community somewhere that belongs and that can outlive you potentially.
Yeah.
Those are critically important times. And also really to connect with the organizations who get it, other families, and also with healthcare practitioners who can understand that, for instance, something that we know is that sometimes we see epilepsy develop in the teenage years in autism, so that who can tell you that's not unusual, and who can provide reassurances and who can also push back against much of the misinformation that we see online about the nature of autism, about what you might be experiencing, and to get access to factual information so that you balance both facts, caring, supports in a place that makes you feel confident about belonging in a community.
Great way to end. Marg, thanks for everything that you do with Autism Ontario and the organization. It's such an important part of the system of services that's available in our province. Great leadership and great impact that the organizations have. And thanks for spending some time with us today.
Thanks so much, Brad.
I hope you found the conversation with Marg both informative and inspiring. We have a lot more to discuss, and we will definitely bring back Marg for a future podcast. As we continue to navigate the increasing prevalence of autism, it's crucial that you stay informed and engaged with the latest developments and support systems that are available. Marg's insights have shed some light on the importance of advocacy, inclusion, and the ongoing efforts to improve the lives of individuals with autism and their families. Remember, your involvement and support can make a significant difference. Stay connected with Community Living Toronto for more discussions on vital community issues and ways that you can contribute. Until next time, take care and keep making a positive impact in your community.
Don't forget to join us next time as we unpack the power of community through collaborative initiatives and shared experiences. Available on Buzzsprout, Spotify, Audible, and YouTube. Follow us on social media at CL Toronto. Let's chat, share, and spread those good vibes together. We hope these discussions will inspire you and give new ideas to add your voice to our mission of making our communities and neighborhoods inclusive and welcoming.